So let's do just body weight movement here. He's going to start here and slowly lower his arm into full external rotation. So the movement was external rotation. What type of contraction?
Eccentric.
Eccentric. What muscle group?
Could be your internal rotators.
Because the only force acting upon the body was the force of gravity. So as he descends, the external force, gravity, overcomes the internal force from his muscles. If I amplify gravity a little bit, I'm going to push you down, okay? I want you to just control it nice and slow. If I amplify gravity, nothing changes. This is his internal rotators contracting eccentrically, pop up, and now his internal rotators contracting concentrically, right? Internal rotators eccentric, internal rotators concentric. That hasn't changed. All I've done is make gravity a little bit heavier, right? I've added my force to the force of gravity, but everything is still pushing him in a downward direction. Eccentric, concentric, eccentric, concentric. Good so far. We're gonna go one last step. Everybody's happy? What if the external force, that's gonna be me, is providing a resistance upward that's greater than gravity? You should force your arm down. Pull, 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 pull. My force is pulling him in what direction? Pretty strong, right? Resist, 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 resist. I'm pulling him up the entire way and pull, 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 pull. I'm always pulling him up. Now, in this case, in order for him to overcome the external force and down, what's he need to do? Concentrically contract what muscle group? It's one of these groups we said. So let's pull my hand down. Go, pull, 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 pull.
Yeah, there's a contract.
What's he doing? External rotation. What muscles? External rotators. How are they contracting? Concentrically. So we spent a lot of time last term saying if the only resistance acting upon the body is the force of gravity, but now we're going to add other forces starting today. And the force we're going to add today is a manual resistance from an examiner, which is going to be greater than the force of gravity. So it's the new primary resistance we're talking about, right? I might be moving him in the same direction as gravity. I may mirror the direction. In which case, I'll do like 10 reps so we can talk through this. In which case, he's got the, nice and slow, internal rotators contracting eccentrically. And then in the other direction, the internal rotators contracting concentrically. Internal rotators eccentrically. Internal rotators concentrically. Because the only direction we're going is downward, right? Gravity's pulling him down and pushing him down. So regardless of whether he's moving up or down here, it's his internal rotators. Everybody comfortable with that? Now I'm pulling him this way. Down, 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 down. Now, the force I'm giving him is greater than gravity. I know this because if he stops resisting, I'm going to pull him this way. Right? That's strong. So, in order for him to do this now, because I've changed the primary force acting on him, we have the external rotators concentric and the external rotators eccentric. External rotators concentric and external rotators eccentric. The only force acting on him is no longer just gravity, now it's gravity plus me. Conceptually, that's the only way we're pivoting today. Is that okay? Everybody feels confident with that? Opposite of what? Maybe.
Like the first rule compared to like what you're doing now.
So all I've done is rename. Address his shoulder flexors. Without reading, where do I want to provide my primary resistance? Exactly. To the distal end of his anterior humerus. If I want to strengthen his shoulder flexors, and this is true for MMT, this is true for MREs, I want to apply my force to the distal end of that bony partner. When we're addressing the GH, the distal end of the bony partner is going to be the distal anterior humerus. So my primary force is right here, and I'm just supporting the forearm, maybe giving a little bit of force there, but this is where it's primarily coming from. And I want my force to be, remember, perpendicular as much as possible to his arm. So I'm not going to be trying to give him a force from here to match my resistance. This would be really hard for me. It'd be weird, right? Be as perpendicular as you can. Okay, ready.
Apply resistance to the anterior aspect of the distal arm or to the distal portion of the forearm if the elbow is stable and pain-free. Stabilization of the scapula and trunk is provided by the treatment.
That's it?
Yeah, that's all it says.
All right. Mr. D, here's the motion we're gonna do. You're gonna bring your arm up and overhead against my resistance, and then slowly control as I bring you back down, okay? You're gonna bring it up overhead, overcome my force, and then control as I bring you back down. Got it? We'll do an out loud count of 2 on the ascent all the way overhead, and an out loud count of 2 on the descent as we come back down. For our first rep, I am always pulling him in the direction of extension. As he's here, I'm pulling him down. As he's here, I'm pulling him this way. As he's here, I'm pulling him here. As he's all the way overhead, I'm pulling here. My force is this force into extension. Always extension. The external force from me is always in the direction of extension. So what muscle group is working the entire time on the ascent? The flexors. How are they contracting? Concentrically, because the flexors are overcoming my extension force. The internal force of his flexors is greater than the external force of my extension force. How about on the descent? Now, my extension force is overcoming the force of his flexors. The external force is greater than the internal force. What type of contraction? And what muscle group? Flexors. So we've got concentric flexors, eccentric flexors. Concentric flexors, eccentric flexors. Put everything together. Out loud count of 2. You ready, Mr.
Yes,
D? We're
sir.
gonna do 5 reps. Go. Let's make it a 3 count. Again, my force is as perpendicular as possible throughout the entirety of the motion, which means I've got to get myself moving a little bit. I'm always pulling into extension. Primary force is here. Secondary force is on the distal end. I think I got it all. That's good. All right. Questions about flexion? Yes, sir.
My biggest question is, what is this helping with?
Great question. What is this helping with? Why am I? Flexion, picking up and over. And then we're going to pause at the top of flexion to figure out our hand placement for extension. I'm going to turn around. Right? When I did flexion, I was oriented toward his shoulders and face. But if I want to do extension, I want to be oriented toward his hips and feet. And I'm going to change hands. I'm so envious of your squat tech. So envious. Distracting. Oh my gosh. We're going to change our hands. So, easy way to think about this. It's going to be easier for me to provide meaningful force from my outside hand here. It's going to be kind of hard for me to provide force if I'm constantly like banging into his torso. I'm constantly banging into his face. Your primary force is going to be your outside hand. Here. And then when we switch to do extension, I don't want to be giving my primary force from here. I'm just going to switch hands. If I'm giving an extension force, I want to be on his posterior distal humerus and the ulnar side of the hand instead of the radial. All I've done is flip my hands. One more rep. Up, 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 up. Pause. Now, my external force is always into the direction of flexion. I'm always pulling him this way. He's here, I'm pulling him here. He's here, I'm pulling him up. He's here, I'm pulling him up. I'm always pulling in the direction of flexion. As he brings his arm down toward the table, the motion is extension. It's what muscle group contracting?
The extensors.
The extensors. And how are they contracting from here all the way down to the table? And how about from here, as he resists and I pull him up? Eccentrically. Now we read.
Apply resistance to the posterior aspect of the distal arm or the distal portion of the forearm. Stabilization of the scapula is provided by the table.
That's it?
Yep.
Okay. Mr. D, same rules as before. Out loud count of 3 on the way down. Ready?
All right, 1.
One last time, hand placement for both. For flexion, outside hand, distal humerus anteriorly. Inside hand, best buds. Lets me support the wrist and hand. When we get to extension, I just flip those around. Outside hand, distal humerus posteriorly. Inside hand, distal wrist. A little harder to be best buds on this one. Try it if you want. All right, we'll do, yes sir.
I have a quick question. So,
Abduction, we're gonna be best buds. Again, easy to remember, easy cue. Elbow's gonna be bent to 90. I'm gonna give my force to the lateral epicondylar region of the humerus. And we're gonna be right here, a quick stretch. And we're coming out only to 90 because we're in this non-externally rotated position. So we're not gonna exceed 90 unless we were to modify the position a little bit. And then eccentrically, resist, 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 resist. So push, 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 push. Resist, 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 resist. And you'll see any given angle, I'm about 90 degrees relative. But here, I'm about 90 degrees. Here, I'm about 90 degrees. I'm always pushing straight in, so it's just me moving my hips a little bit. That's abduction. Ready, go ahead.
Apply resistance to the distal arm with the patient's elbow flexed to 90 degrees. To resist abduction, apply resistance to the lateral aspect of the arm. Go into
Keep going,
adduction.
yeah.
Okay. To resist adduction, apply resistance to the medial aspect of the arm. Stabilization
Hold
is
on. So all I did was change hand placement again. For abduction, I was out here, and I was holding him up high enough that he wasn't just on the table, right? We don't want this hyper horizontally abducted position. I was holding up to a position I was happy with. My abduction force was here, not grabbing the whole arm because this is confusing and it probably cues what motion. Ah. So I'm going to be on the lateral epicondylar region. For adduction, I just move to the medial epicondylar region. Same thing, just from here to here, and my adduction force. Stretch. Okay.
Stabilization is applied to the superior aspect of the shoulder, if necessary, to prevent the patient from initiating abduction by shrugging the shoulder.
If your patient does this, we're going to have to stabilize differently. This is a big problem we're talking about over the summer. If you have patients initiating movement like this, stop what you're doing. We're going to fix that first before worrying about strengthening. This is a really nightmarish motor pattern to fix. Precaution, important precaution.
Precaution. Allow the glenohumeral joint to externally rotate when resisting abduction above 90 to avoid impingement.
Yeah, so if you were to go past 90, we're going to change our position a little bit. So abduction, we're here. Adduction, we're here. We're a little faster this time. It's not only easier, but you've already had some practice. So let's take 5 minutes for these. This is our arc of movement. We're going from here to here. It's this 90-degree arc. This is where we're best able to get the glenohumeral joint moving. Anything past here tends to be a lot of scapular protraction and not the motion we're looking for. So the book is just a static image, and it kind of shows this picture here. But for both internal and external, this is our arc of movement. So on yourself, this is where we're working from. And there's a lot of people whose shoulder just doesn't go very far past this. Right? So we don't want to be trying to address a range of motion that maybe doesn't even exist. So here is our 90-degree arc. It goes a lot further than that. But that's it.
You do.
Manipulation.
Which part of the joint capsule would we have to address to improve our internal rotation mobility?
Goes in the posterior.
So you got a few options: distraction or posterior glide.
Hey,
Few
trying to
options.
make it work.
All right. So the other thing missing from the image for external rotation, if you look at the previous image, is the clinician's failing to stabilize the lateral epicondylar region. We do want to make sure to stabilize the humerus during this to prevent ab and adduction from occurring. So we're going to stabilize the humerus. Mr. D, this is the motion we're going to do. You're going to bring your arm back against my resistance and then right back up as I pull you. Got it?
Got it.
I'm going to bring it back in that direction and right back up. We're going to go back for an out loud count of 2 and up for an out loud count of 2. I'm going to overcome my resistance on the way down and resist and slowly let go on the way up. Got it?
Got it.
So see, I gave him instructions while I was kind of taking his arm through the range of motion so he knew what I expected. We did a few like warm-up reps almost until we're ready to go. Quick stretch right here, and resist, and push, and resist, push, and resist, and push. Quick stretch again, cues the concentric right there. That's external. Again, conceptually, make sure you feel comfortable with the idea that as his forearm goes down, there's a concentric contraction. Because my force, which is greater than gravity, is pulling him up. My force is pulling him into internal rotation. He is overcoming that with his external rotators. So where should he feel fatigue during this exercise? His external rotators. Take a big picture, kind of the back. In his pit muscle group, right? Versus when we do internal, he's going to feel it in his splat muscle group, which is kind of across the front. Same motion, Mr. D, but I'm going to give you a force in the opposite direction, okay?
All right, sir.
Stabilizing just like we always have, right on the anterior scapular region, coracoidocromion, lateral clavicle, keeping it from protracting. Rest of that hand is going to keep the medial epicondyle from moving. Here's the motion we're going to do. Up, right to this point. Again, our internal rotation is going to take us from full external all the way to neutral. Going to go up for a count of 2 against my resistance.
1, 2.
And then resist as I bring you down.
2.
My cue now is on just the anterior aspect of the forearm, pulling him into external rotation. And my quick stretch is right there at the bottom. Always cueing the concentric with your quick stretch. Good. Questions about our rotations?
To strengthen the elbow flexors, apply resistance to the anterior aspect of the distal forearm. The forearm may be positioned in supination, pronation, and neutral to resist individual flexor muscles of the elbow.
Pause there. Position in supination if your target tissue is the biceps. Position in fundamental, neutral, or semi-pronated if it's the brachioradialis. And position in full pronation if you're trying to limit both of those and therefore bias the brachialis. I'm going to just demonstrate in supination for simplicity for all of this.
To strengthen the elbow extensors.
Oh, let's do the flexion. Sorry, I didn't realize there was another bullet point. Mr. D,
yeah,
this is the motion I want you to do. You're going to bring your arm up against my resistance and control it as I slowly bring you back down. You're going to bring it up against my resistance for an out loud count of 3.
Okay.
And then control as I bring you back down for an out loud count of 3. So pull
2.
and resist. Tell them again what my stabilization is, Haley. No, it didn't have that bullet point.
It just says to strengthen the elbow flexors, apply resistance.
Stabilize the proximal
There we
portion
go.
of the humerus.
Where do you see? Oh, that's under the, stabilize the proximal portion of the humerus during both motions.
Perfect.
But that's after the
Extension.
strengthening the
Sorry.
elbow extensors.
Wasn't trying to set you up to fail.
No, you're good.
So, again, that perpendicular force, I'm moving throughout most of the motion here so that my forearm stays relatively perpendicular to his. And then each time I'm trying to cue the concentric with a quick stretch, right? Not at the top, but rather at the bottom right here. We cue the concentric. It's a quick stretch to the muscle being strengthened, which activates the spindles, which does the stretch reflex, which cues the concentric. Okay, let's flip it around. Elbow extension.
To strengthen the elbow extensors, place the patient in prone or supine and apply resistance to the distal forearm.
All right, now running with the opposite way. You're gonna push into my hand right here, and then control as I bring you back up. And push, and control. You can do this in prone like the MMT if you'd rather, but again, we're trying to simplify how many different positions you have to learn, so since the book offers this, we're gonna offer it as well. 3 minutes to do faster, just because we're taking the same concepts and all we're doing is shifting joints. So that's why we haven't spent nearly as much time at the elbow and wrist as we did at the shoulder. 4-hour wrist manual resistance exercises. When I want to strengthen his extensors, I'm going to position him in pronation so that I've got gravity resisting in addition to my resistance. To strengthen the extensors, we're going to do extension. I'm going to stabilize right here. trying to remember how to stabilize for wrist extension, I don't want to stabilize on the extensors and create deep inhibitive pressure that stimulates the GTOs. You're right here on the other side of the joint and allow the extensors to do their job and not be inhibited. I'm going to give my force to strengthen the wrist extensors to the distal end of metacarpals 2 and 3, the metacarpal heads, because they're stable. Because if I'm going to strengthen the wrist, I want to be on the distal end of the metacarpal. And I'm going to be pulling him into a direction of flexion. So you're going to bring your hand up against my resistance and then back down. You're going to bring it up against me and control as I bring you back down. Got it?
Got it.
Make sure you don't come in here and crush the CMC of the thumb. You want to squeeze into the web space just like we've done for a lot of our previous techniques. We'll do it for an out loud count of 2.
1, 2.
And control or resist as I bring you back down.
2.
Okay. For flexion, we're just going to spin it around. We're going to now stabilize the posterior aspect. We're going to give our force to the anterior aspect of the 2nd and 3rd metacarpal heads. And our force is into the direction of extension. Just the opposite. You're going to bring your hand up against my resistance for an out loud count of 2 and control it down for an out loud count of 2. Got it?
Got it.
And go.
1, 2.
Quick stretch we apply is at the end of extension to cue the concentric, right? We're going to cue flexion by rapidly stretching the flexors when the wrist is fully extended, right here. Bounce occurs right here. Quick stretch to the flexors cues the concentric. Last 2 MREs.